it and been like, hey, here's what we're gonna do. These are the other things that we're gonna talk about. We don't want it just to be for the 1 month, but we also want it to, kind of be a little bit more than just that. So I like the whole concept of that. I like what they're doing with it. Really good. Keep up the great work, right? Keep up the great work. I really do appreciate that so much. Y'all don't even know. But yeah, I'm gonna check it out. Definitely got to support more than just for the 1 month and just stuff like that, you know. But yeah, hats off to them, and that's really really good. I like what they're doing with it. Very very important. Right, you know. So yeah, I'm all for it. Y'all go check out that festival. Just to see the culture and everything like that is really good. Something that we should all really be into. Really should strive to learn more about and just kind of dive into that culture and just learn a little bit more about it. Right. So yeah. So we're going to go ahead and jump into the next topic. Next one is Bernalillo County provides mental health resources to frontline health care workers. So we know this is definitely something that's very important. So we're going to see what they have to say. And I think it's a very important thing to do.
Oftentimes, our frontline healthcare workers are so busy worrying about the needs of others, they forget to address their own mental health and their well-being. That's why Bernalillo County is working hard to ensure that all frontline behavioral health employees are safe and taking care of their own mental health first and foremost. I spoke with Department Director Margarita Chavez Sanchez to find out more details about the resources that Bernalillo County is providing. Joining us this morning, we have Margarita Chavez Sanchez. She's with the Department of Behavioral Health Services. Good morning.
Good morning. How are you?
I'm doing well. Thank you so much for asking. Margarita, this is a super important conversation that we're having this morning because we're talking about frontline workers and their mental health, which we all know right now they are at the forefront of this pandemic. So let's talk about that. Right now that frontline healthcare workers are dealing with so much, how is your department helping them cope with all of this?
Absolutely an important topic, right? We have been working for the past 11 months on helping others, connecting clients to services, and really working to care for others in need at this time. So what we're really seeing in this space is provider burnout. And so it's really important for us at the Department of Behavioral Health Services to make sure that we let frontline healthcare workers and any essential worker who's been working at this for all of this time, that they can access the resources too. When they're referring their clients to services and supports, they can access that referral as well. So at the Department of Behavioral Health Services, we're funding over 40 different providers along the continuum of behavioral health care, and we also promote the New Mexico Crisis and Access Line. So we want to make sure all the frontline healthcare workers know that those services are available to them.
Okay, so many different resources, especially, sometimes you just need that person to talk to and confide in about how you're feeling. And we've heard it. We've heard it from frontline workers that they're dealing with a lot of depression. They're dealing with a lot of anxiety. So much going on at this time. So let's dive a little deeper into how do we make sure not only their mental health is okay, but how are you guys keeping your employees safe?
Well, at the Department of Behavioral Health Services, it's all encompassing. So we distribute N95 masks weekly to our staff. We've had a couple incidents where we've had clients come to access services with us, and then they've tested COVID positive later on. And so in order to add those extra precautions for our staff, we're distributing N95 masks to them. We've installed plexiglass partitions. We've implemented markings on the floor, like you see even at the grocery store, for social distancing, and really checking in with our staff. The big thing that we've also added that's really important is at the beginning of every shift, our clinicians are also adding a component of mindfulness. So 5 minutes at the beginning or the end of every shift to just stop and go through a mindfulness exercise where the staff can debrief, have an opportunity to just relax and be in that moment to have that self-help, self-care opportunity. We're also working on establishing a vicarious trauma training for all of our clients and all of our staff. And so while we know that the clients themselves have experienced loss, across that continuum, right? Loss of loved ones, loss of job, loss of opportunity, but also our staff, right? They're seeing that loss in their life as well, and all frontline healthcare workers. I was recently having a conversation with the Cabinet Secretary of Aging and Long-Term Services, and she's navigating ways to get resources.
Okay, no, I like that. I like that, right? To provide that opportunity for, mental health, right, is really good because I mean, like, I'm not in the, I mean, I'm like kind of like in the frontline worker, like kind of like on the borderline because I'm cleaning community centers, things like that. But I'm not on the front line like them, where I'm like dealing with the patients that have COVID and stuff like that. So like I don't know it to that certain extent, but I could understand where they're coming from and just that they need that, right? Because that's a very important thing is the whole mental health thing, right? Because they're seeing it like in front of them, but then they're dealing with it on the side. They're just dealing with it from all like directions, and this is something that I'm glad that they're providing, and that they're providing the N95 masks and stuff like that. That's great. Taking care of the workers, trying to cover all bases when it comes to precautions that need to be taken 5 minutes before and 5 minutes after like these like interactions or whatever, to debrief and just to have that opportunity for self-care and self-love. Amazing, right? Meditation, all this stuff is like great. And the fact that they're like, hey, you know what, we're gonna provide you that opportunity, you got that 5 minutes, do it. Very important, right? Have that self-care, have that self-talk, right? So I love that they're doing that. I love that that's the approach they're taking, everything like that. So kudos to them, hats off to them. I salute y'all. Keep doing your thing. Keep pushing. Keep just being a beacon of light. Keep doing what you guys need to get done. Healthcare workers definitely are the true heroes in all of this, and I will always keep supporting that no matter what. But yeah, so just keep doing your thing. Keep grinding. Keep pushing on. I appreciate everything that y'all do so much. But yeah, um, yeah, great work on their behalf on doing what they need to get done to make sure everything is good. I'm all for it, and there's nothing wrong with that, like whatsoever. So yeah, big supporter of it. Keep doing your thing. Definitely needed in what's going on, and just the stress that they probably go through daily. So yeah, it's good. So we're gonna jump into the next one. Families of Officer Jarrett speak out for the first time. This officer, it was an officer involved shooting. They, I believe they killed him. I didn't really see some of the other videos on it, but yeah. So this is just crazy. Condolences go to the family and the friends and everything like that. Never want to see a fallen officer down or anything like that. If you made it to the end of this video, I appreciate you so much, more than you ever know. So, Crayon Rocket, our motto is be unique, be creative, be you. Why is this important? Because we were all created in the image of God. We were all perfectly and wonderfully made. So I hope that you enjoyed this video. Share it, like it, subscribe. I would appreciate it. God bless.